Do you suffer from premature ejaculation or wish you lasted longer in the bedroom? Hi guys, I'm Dr. Kid, and in this video I'm going to do a countdown of the top 5 medications that can increase your time to ejaculation, with the top performer being able to 11x how long you last in the bedroom. Now just quickly before the countdown, there's two key definitions you need to know as they're referenced in the countdown. The first of which is the IELT. This stands for the intravaginal ejaculatory latency time. This is defined as the time between penile penetration of the vagina and ejaculation. So this is the core measure of how long you last in the bedroom. The second definition to understand is half-life, which is defined as the amount of time it takes to clear half an active substance in your body. The other thing to mention is that society can place a lot of pressure on how long you last in the bedroom, and this can cause significant distress. To give you some context and numbers, one study showed that the average IELT time was 5.7 minutes long, with a massive range between 0.1 minutes and 52 minutes long. But when you look at studies asking people how long they want to last in bed, it's usually longer than the average, somewhere between 7 to 13 minutes long. Therefore, one critical point to note is that if you and your partner are happy with your sex life, then no treatment may be necessary regardless of the duration of sex. However, if you're not happy and want to prolong the duration of sex, these are the top 5 medications that can help you do this. Number 5. Tramadol. Tramadol increases IELT time between 4 and 7.3 times your baseline. Tramadol does have a range of IELT fold increase, and if I was actually to take the upper range of this, it'd actually be higher on the list. Tramadol is typically used as a painkiller medication, and its main disadvantage is that it can be addictive as it's an opioid medication. Tramadol is the only one on this list where its recommended dose is an on-demand only, meaning you don't have to take a tablet every single day. Number 4, sertraline. Sertraline is next on the list, which 5x's your IELT time. Just to clarify this meaning, it means that if you normally last 1 minute in the bedroom, it would increase to 5 minutes with sertraline. This is a medication that's typically used to treat anxiety and depression and increases serotonin in the brain. In fact, all the medications on this list today increase serotonin, and this is the key chemical that needs to be altered to increase ejaculatory time. The recommended dosing regimen is to take between 50 and 200 milligrams daily, and on top of that, take an additional 50 milligrams 4 to 8 hours before sexual activity. Number 3, fluoxetine. And number 3 is fluoxetine, which boosts the IELT time by 5x, just like sertraline. Fluoxetine is also another SSRI and was initially sold under the brand name Prozac. It is also used typically to treat anxiety and depression and has very similar side effects to sertraline. The reason I put fluoxetine above sertraline, even though they both increase IELT time the same, is that fluoxetine, the recommended dose is 20 to 40 milligrams daily. It does not need the on-demand dose like sertraline does. Number 2, Clomipramine. Coming in at number 2 is Clomipramine, which 6x's your IELT time. This is an older medication that was typically used to treat depression, OCD, and anxiety. It falls under the class tricyclic antidepressants, but does have some effect on serotonin receptors like all the other medications on this list. Typically, tricyclic antidepressants have more side effects than the SSRIs. For premature ejaculation, the recommended dose is 12.5 to 50 milligrams taken as a daily dose. Number 1. Paroxetine. This leads us to the most effective medication for premature ejaculation, paroxetine, which increases IELT time by a whopping 11.6 times. However, to get this result, you need to take paroxetine as a daily dose for at least 30 days, and on top of that, take an on-demand 20 milligram dose 3 to 4 hours before intercourse. If paroxetine is only taken as a daily dose, then there's only an 8 times increase in the IELT time, which is still the highest on this list. Interestingly, if you take paroxetine as an on-demand dose only, which is the most ideal to limit side effects, there is only a 1.4 increase in IELT time. Paroxetine belongs to the class of SSRIs and has similar side effects to the other 2 SSRIs on this list, fluoxetine and sertraline. There is another key medication to be aware of when it comes to premature ejaculation. This medication is known as Paroxetine. The disadvantages of the medication on this list are that you have to take it as a daily dose, or the only one that's on-demand, Tramadol, has a high risk of addiction. This list was purely based on how much a medication could increase IELT time. Paroxetine is typically taken as an on-demand dose only and there's no risk of addiction. If you'd like to learn more about it, check out this video here that I've made. Don't forget to like and subscribe, and I'll see you in the next video.